You recommend DBT or DBT, first for the child and family. What does that entail? What does that look like? What are we signing up for?
Yeah, that's usually the first thing we talk about.
Yes.
I usually have a pretty blunt conversations with families that this is intense. It's, it is a weekly therapy. It's 90 minutes a week. So you start off the treatment with just parents. Because the theory behind it is that a child is not able to be regulated until they have a validating and regulated environment to support their progress. So we have a biosocial theory, which means basically how we conceptualize individuals who we refer to as super sensors. And a super sensor is kind of what we talked about, right? Someone who has these big emotions. They're more sensitive than their other kids or even siblings, right? And they take a really long time to calm down. And it's these big explosions, right? And so, the biosocial theory is that you have this kid come into the world, right? This is their hardware that is just born more sensitive, right? This is just how they are. And then they come into this family who has no idea what to do with this individual, right? And we know, and I tell every family this, good enough parenting does not work with severely emotionally dysregulated kiddos. And I always want to make that clear because I think I get a lot of parents coming here and feeling like failures. I'm like, no one knows what to do with them, right?
Yeah.
Good enough parenting isn't enough, right?
Right.
I wouldn't know what to do with the super sensor unless I had this training. So I'm going to give you my training.